Hello, and welcome to the first in our series of podcasts on researching sexual health. It's brought to you by SWIG, which is the Sexual Health and Wellbeing Interest Group. We are a group of researchers planning and doing research on sexual health, well-being and sexual violence. SWIG is a special interest group within the Psychological Science Research Group, PSRG, here at UWE Bristol. My name is Jane Myrick and I'm a health psychologist, and today's episode is a conversation with KevinTurner. He's a health psychology trainee and sexual health advisor across a range of sexual health services in Dorset, and it's about his plans to carry out research with and for sex workers. I'm going to be talking today to Kevin, who's one of our trainee professional doctorates in health psychology. So Kevin, say hi, and do you want to introduce yourself?
Oh, yeah. Hi, Jane. So my name's Kevin. I work as a senior health advisor within sexual health services based in Dorset. I'm currently enrolled on the professional doctorate course at UWE to become a chartered health psychologist. And I am currently undertaking some postgraduate research looking into the experiences of men who sell sex for money.
Excellent. So let's talk about what you're doing for your research. So I'm going to have this conversation in kind of series of question and answers, but this is basically what we normally talk about, isn't it, Kevin? It's just kind of our basic supervision, but recorded for the purposes of a podcast. So what you've done so far is called a systematic review. So do you want to tell us, first of all, what a systematic review is, and then what did your systematic review tell you about sex workers and some of the research?
Okay, so with my systematic review, I was looking at the psychosocial interventions to improve sex worker health and well-being.
What do you define psychosocial interventions as?
So
What does that
with
mean?
psychosocial, it was very much a departure away from STI testing. So a lot of research that looks at sex workers tends to look at it through the lens of sexual health, or a lot of the time it's looking at violence. A lot of the evidence that I found was very much restricted to female street-based selling sex workers. And my experience was that males in particular were very much underrepresented within that sort of sample framework. The evidence that I found was very limited. There wasn't an awful lot of studies, and from the very little that I did find, the evidence was very poor. There wasn't really anything there for me to make any clear evidence-based recommendations. The small number of studies has raised quite a lot of questions around how we best engage with sex workers. I think those small numbers reflects the challenges of studying this population. So it's something today that I'm bringing to supervision to discuss with you about how the next steps in the research, given what we've found out, and how to maybe engage with sex workers to produce meaningful research that really sort of encapsulates their voice and their needs.
I think that's really important. So I think having looked at some of the work in the field, what you don't hear is their voice.
Yeah.
But at the same time, there's people saying if you want to work with a sex worker, you need to pay for their time. So that's something you wanted to talk about, wasn't it? This kind of possible accusation of exploiting sex workers to pay a sex worker for their time. Is that at the same time exploiting them? So this is something I think you need to think of in a broader ethical framework of what other research participants get and do.
Yeah.
So it's absolutely normal to compensate people for their time and any expense they go to either, come to an interview or stuff like that. So that is absolutely normal and regular. Whereas I think if you were starting to buy a slot of their normal working time, I think it's that categorization that has meaning for me. But what I'm also concerned about is that we don't decide, you and me, here and now. This isn't for us to decide. We're kind of coming at it as academics, and we don't know better. They know better. So speaking to a range of people working is the best way to sort that one out. What does that sound like for you? Does that sound possible?
So, no, really good. When I had a look through some of the included studies in the systematic review, a lot of the participants that engaged in the research were given incentives, and there seemed to be avoidance on cash. So a lot of it were coffee vouchers, transport vouchers. I recently attended a webinar with the British Sociological Association, and this did come up within a really, really good webinar done by Victoria Holt around the contentious relationship between sex workers and academic researchers. And within that, there was very clear messages that if we were engaging within within sex workers, that we should be recognizing their time.
Yeah. And I guess it's asking yourself what's same and what's different within ethics. So I've sat on ethics boards a lot, so I know what the compensation versus incentivization thing is. You don't want to incentivize people or, it's the idea that you compensate for time. And that's why vouchers are always favored, because it's not seen as money. So I would like to have a chat with somebody and go, if you were doing research about your work, would you see that as your work, or would you see that as something you did in your free time? And
Yes.
I think that requires the voice of sex workers to speak to that. And I think that would be very different. It's also not seeing sex workers as one lived experience. I think the range is so huge. And I think we need to talk about that a bit in terms of, you mentioned it in relation to any published research that's done so far on sex workers tends to be on the chaotic street sex worker population, but there's a huge range of experiences under that badge, and why you would be looking. So I think that focus comes from the greatest harm in terms of how you can view some of the outcomes for that group and their lived experience and their experience of violence and drug addiction and all kinds of vulnerabilities, and therefore some of them need more help, but that isn't the full range of experiences. You've talked to some people as well. What did you get in terms of who you think you need to look at more?
Yeah, absolutely. So particularly men were very underrepresented. And when I was looking through some of the wider literature, the sex working community of males is very different. A lot of men are engaging in sex working practices, but they're not identifying as sex workers because what they're doing doesn't resonate with street-based, drug sort of motivated work. When you look at the platforms that they are operating on, they vary greatly. So they tend to be more sort of digitally based, sort of online platforms through OnlyFans. Historically, when we look at sex work, it used to be characterized between direct sex work and indirect sex work, which was then used to profile the levels of risk. So I believe there is a misconception that because a man is online doing something on their OnlyFans account, that is low level of the risk. But actually, psychosocially, it could be an increased risk because there's things about isolation. They could be going through situations where they're oversharing. They could be having unprotected sex with other platform contributors. And if they are operating online, they're probably unlikely to access support services who may or may not be providing the relevant services for that. Within the literature, the need generally doesn't extend much further than them having hepatitis B vaccinations, condoms, or access to PrEP. So within that, there is this great unmet need because we're not asking them what it is they actually want, what do they need? And I think that's where this research could be really beneficial.
So listening to what you've said there, you've clearly picked out that you want to focus down on male sex workers, but within the range of potential logistic platforms within that. So that could be OnlyFans, it could be just selling imagery, it could be how does that extend into contact-based transactional sex, and but really from a public health risk reduction perspective, is that fair?
Yeah, absolutely.
Yeah.
I was in clinic the other day at work, and I did have a chat with a patient who had recently exited sex work. And thinking about this research, I was like, well, actually, I'd be really interested to know a little bit more about the reasons why you've exited. Because if we have an understanding about that, we might be able to introduce some interventions that might have otherwise supported them staying within it. And a lot of interventions that I've been reading about online, they tend to be sort of based within this sort of outcome of encouraging people to disengage from sex work or through exiting programs. And I don't always think that's the focus to follow. It's about giving people access to the information and the resources so they're making informed decisions and that they're well supported within the work they want to do.
So a kind of more harm reduction empowerment model.
Yes, much more of an empowerment one.
I think that's interesting because it's just made me think about choice and how people end up doing something that maybe they wouldn't have thought they did.
Yes.
So how do you choose to go into sex work? And I think there is a range of experiences, but what we've seen from some of the local research by the Bristol Drug Project, for example, was around male sex workers seeing sex work as a kind of a short-term option in a bit of a crisis, a kind of a problem solver.
Yes.
And therefore not identifying as sex workers because it's not a job. It was just, I got a bit stuck with the rent that week and I did this and therefore it was just a thing that's over. So that kind of crisis problem solving is really interesting, that we need to look at that a bit more. And that therefore the compensation for that is not to say don't do that or how can we stop you doing that, but is to open up their choices and to help them see the range of choices and to empower them to be as safe as possible if that is their choice. I think a kind of a judgment-free approach. Yeah?
Yeah, I've read some work by Michael Darius, who's a French sociologist, who kind of looked at some of this with some male sex workers and very much echoed in the literature. Some of the women are referred to as survival sex. So they're engaging in sex works because there's literally nothing else for them to do. But when we kind of look at how male sex workers operate, it sometimes offers them this sexual liberalization. So they're able to engage in sort of broader sexual behaviors that satisfy their sort of sexual curiosity. A lot of it can be to generate a disposable income to fortify their gay culture.
What I would like to ask you at this point is, where do you think you should go from here, and what do you think your main study should be about then?
Okay, so I think my main study is going to just strip everything right back to basics. We know there isn't hardly any research about male sex workers, particularly around psychosocial interventions. One of the main criticisms I had was that a lot of research is based around an assumption about what sex workers want rather than it being reflective of their actual need. So I think this points towards a nice, neat, qualitative study that really explores what the issues are for these men, and sort of to learn from their voice about, does the mind that have the problem has the answer? Are they able to make recommendations? Are there barriers to services that they particularly want to access? Do those services exist? I think within my sample, I'm really keen to capture a very broad voice of lots of different expressions of male sex work, from people who are active within the community, from those who have maybe exited, from those who are providing direct contact through rent, or from online platforms such as OnlyFans or the others that are sort of out there.
Yeah, I think what we know, a lot of what we know also is from Marianne Hester's review that she did for the Women and Inequalities Inquiry into what they call prostitution, which is not a word I feel comfortable saying anymore. At the same time, sex work also is a barrier to some groups. So I think what I found from that overview of the research was the massive gaps and the diversity. So there's no one group. And so you're wanting to pick out a population, but within that, the huge range of ways of engaging in different types of transactional sex. So we could even talk about it as the behavior. That's what you do a lot of in sexual health services. You don't talk about groups or risk groups. You try and talk about these behaviors and what we can do about those and how we can support harm reduction around certain behaviors. So I think it's interesting that you've picked up on those language signals and what they mean. What I wanted to ask was, how are you going to check out your assumptions about what you think the best or the next step should be?
That's an interesting question. I'm really keen not to let my assumptions infiltrate too much on the approach the research takes and recruiting participants to legitimize that. What I really want to try and do is uncover those key research questions that are worth exploring. Part of me was curious to maybe interview workers within sexual health settings to find out what their perceived risk, so that it gets it all out of the essence, and then maybe compare that back to what I actually find from men engaging in selling sex practices, because I think what that does is just further highlights the discrepancies between the actual real need and those perceived experiences from the people that are trying to provide services that probably aren't being used because they're not actually catering for the need that's required.
Uh-huh. I think I'm going to say that question again, because I want to say, well, how are you going to check out your assumptions about this is the right methodology, this is the right way to ask people those questions? What are you going to do about getting participant voice into how you do the research rather than just the research itself?
Yeah, absolutely. So I am particularly keen to maybe present the findings of the systematic review within a platform which encourages people from sex working communities to feed back about what I found. So instantly, just to maybe triangulate the findings that I have found. It would be useful to hear what some of the other academics have to say about that. So potentially doing some sort of webinar or something just to collect some of that, I think would be really, really useful. I think it's really important to, very early on in the research process, to take on board the voices of those people so that they can help to shape the research. And I think one of the really important things that Victoria has highlighted before is that researchers go in very much with an agenda about what the research has to look like, and don't really engage with what the sex workers' thoughts are in response to that. So I think taking that step back to find out what those key questions are really, really important, because I don't want to perpetuate stereotypes. So I think you can avoid that by engaging within your community, because this is who this research is for. This is whose voice, and I really want to promote this feeling of ownership and engagement, because in some of the research that was really missing a collective voice of male sex workers. It's not represented anywhere, not even in the literature. So I think to provide that platform for them, it would be really quite powerful, and might even encourage some change or something within the community itself.
Well, I think we've both talked about the isolation. If you're logistically arranging your transactional sex online, then there isn't a sense that that there might be, I suppose, a collective. Is there any kind of community? There isn't a community.
No.
It's kind of done individually, and I think that previous work has tried to reach people through their profiles on Grindr or something like that. But it doesn't lend itself to any kind of mutual support. And whether are we assuming that they should, and this is the way to go? I don't know. And I guess that's what I'm finding really interesting, is the amount that is unknown in this sector because of the focus on different types, on a kind of one type of sex worker, that we haven't seen the range and the need to hear their voice and to understand how best to support them and with what they want to do. I think what we do know, what I know from kind of more anecdotal, is a sense that female street sex workers' lived experiences recognised and partly catered for, that some existing sexual health services don't necessarily provide things like fast track services for male sex workers.
No.
That people are focused, when they talk about their sex work, about persuading them to stop sex working, and that's the health professional role, or that they just simply shocked at the practices that they're reporting, the risk practices that they're reporting, or the behaviours that might put them at more risk, and that shock therefore creates a barrier to them having their needs addressed in a way that's supportive and non-judgmental. So all of that is about voice. So thinking about a webinar and presenting presenting your systematic review that's really accessible to a range of groups. In one sentence, what did your systematic review tell you?
The systematic review told me not a lot. The evidence was very, very weak. But what it did say was that there is something in there about peer health initiatives, that people are very open and receptive to the idea of this and this idea of giving back to a community. So I think not to listen to that would be really foolish.
Okay.
Listening to what you're saying, yes, I wonder whether using a webinar will sort of bring forward some of those female-led organisations, but it could be that they are already aware of male sex workers, or they're potentially already supporting them, but aren't able to sort of be visible in doing that because of risk of funding.
Okay, yeah, that makes a lot of sense.
Potentially.
So I think we've talked about doing a webinar early December just to present in an informal way, have a chat about what you found so far and where you're gonna go next, and what some other groupings have to say about where you're going to go next and how you're going to do it.
Yeah.
Okay, well, that sounds like a really good plan. But so kind of in wrapping this up a little bit and moving towards where next, what are you worried about?
So I think my main concerns are around the ethics. So in exploring psychosocial need with male sex workers, I kind of need to retain a sense of responsibility about how that voice is presented and how the research is presented, because in some ways, will I make that population more vulnerable by sort of publishing their weaknesses or the issues where they need sort of more support. So I'm kind of thinking about the way in which to engage fully with them, not just as research participants, but in how a sense of ownership about how that research is managed and how it's shared in a way that I don't want it to be another piece of research that someone does because they're interested in sex workers. I want to do something that then can be used to help improve things for them. The other issue that I have is around is predominantly around funding. It's not something that's going to attract a lot of funding interest. So we're probably going to it will be dependent upon me funding sex workers and just the ethics around buying data. But again, we've had a conversation around that. So I think what I might do is try and engage with some sex workers and try and hear their thoughts and experiences around it, because there is an undertone when people have participated in research before. Sometimes they feel a bit exploited, that their involvement is then used to further the academic careers of the researchers, or they will profit from a book or a publication or something. But I really want to make it clear from the start that this isn't what this is about. This is about meeting unmet need and improving things.
I think across the broad range of stuff that I support people doing within sexual health, it's about amplifying voice, and therefore that's your kind of check. If everything you do amplifies their voice, then that's what the work is for.
Yes.
To give them a platform, ensure that they're listened to, and that people aren't making judgments or decisions on their behalf. Is that? And I guess you can check that. And I think that the world of academia doesn't easily support you doing that. It's a slower process. It's about giving away power and making sure you understand the power differentials in a kind of researcher participant relationship, in your health professional, healthcare user relationship, and recognizing the imbalance in power and trying to, if you can't change it, at least surface it, acknowledge it, and say, this is where we're starting from. Okay, that all sounds brilliant. So thank you very much for sharing your research plans. And what I think would be really interesting, if people want to hear it, is that we will every now and again record one of these, but without the terrible background noise from somebody's shower upstairs in the flat upstairs that has just gone on. All right. Thank you very much, Kevin. I'm going to stop the recording here.
You're welcome. Thanks, Jane.
Bye.
Bye.
Join us next time on Researching Sexual Health, when we'll be talking to Uzaj Dwasau, who is also a sexual health advisor, and he's going to be talking about his planned research on looking into the sexual health needs of black men in London. Thank you.